Since last spring, I've been saying that Albertans should expect since this spring, I've been saying that Albertans should expect a great Alberta summer. Maybe even the best summer ever, given all that we've been through the past 16 grueling months. Um, you know, at this stage of this, I don't think it's responsible constantly to be spreading fear. I've heard about CTV reports about that we're headed into the fourth wave, and some person on Twitter with their projections that we're going to be awash in Delta cases, forcing people into the hospitals.
Is there a contingency plan? Is there a plan B if we reopen and we see the hospital numbers start to increase again? We see the R value start to increase again. Is it possible that the province has to pull back on the reopening, or is this in place permanently?
We just don't see that scenario. This, as I said, our intention, this is open for good, not just open for summer.
While COVID-19 cases may rise in the coming weeks and months, a surge of hospitalizations and other severe outcomes is much less likely thanks to vaccines. I know that the rise in cases over the last week has created some anxiety in some people. To be clear, there is no issue with hospital capacity. Anyone who needs treatment will be able to get it, either for a COVID-related illness or for an unrelated issue.
Parents, students, and school staff can look forward to a normal school year this September. Measures like cohorting, masking, and spacing will not be required.
Who are joining us today because COVID-19 is surging once again in Alberta. As it is everywhere across the country and most of the world, the Delta variant of COVID-19 is causing concerning rises in hospitalizations in our province.
Beginning this morning, AHS is going to be postponing non-urgent surgeries and procedures across all 5 zones.
Anyone who gets a first or second dose will now be eligible to receive a $100 gift card.
Minister Shandro, you announced like $36 million in funding today that's largely for continuing care. Can you explain how this will help the immediate crisis in ICUs, in canceling surgeries, and in filling hospital beds? What does this do right now?
But Dr. Yu, further context from you on how this helps immediately.
I just want to stress right now that we're very concerned about our ICU capacity. That is our number one challenge and our number one issue.
People out there are dying right now, Minister. They are dying. Time for action. That's what Albertans are saying. So why are you delaying this?
No, Michelle, I appreciate that. I've heard this from other Albertans as well. It's good feedback for us to get. I appreciate that feedback.